Stroke is one of the most common cause for morbidity and mortality worldwide. And what is a stroke? Stroke is any form of focal neurological deficits which happens due to impaired blood flow to the brain. What are the types of stroke? There are two types of stroke, ischemic stroke and hemorrhagic stroke, among which 80% is due to the ischemic stroke. And in the ischemic stroke, blood flow to the brain is affected because of the clot within the blood vessels, and which impair the blood flow to the neurons in the brain. And in the hemorrhagic stroke, there is rupture of the blood vessel which is impairing with the blood flow to the brain. And among the risk factors of the stroke, which varies from the age groups, as we all know, the stroke can happen at any age from childhood to the elderly. And in the childhood groups, risk factors are mostly genetic, and any inherent problems with the blood vessels or any sickle cell anemia, all those will come into the picture. And once the age grows into the middle age, mostly the causes like vasculitis, any valvular heart diseases, any problem with the heart rhythms, any other congenital heart disease, all will comes into the play. And in the middle age, the stroke due to the secondary to the hypertension, diabetes, and because of the addictions related due to the smoking and alcoholism are not very uncommon these days. And coming to the elderly, the lifestyle diseases like hypertension, diabetes, dyslipidemia, and smoking, alcoholism, all comes into the risk factors. And what are the symptoms? How will you recognize a stroke? This is very important, and this you can remember by the mnemonic B fast. And F is for facial weakness, A is for arm and limb weakness, and S is for speech disturbances, and T is for time. Okay, in this, time is very important. When you suspect a stroke by these symptoms, an acute onset of these sort of symptoms, time is very important. You should rush the patients to a nearby stroke ready center for further management. Once you reach the hospital emergency, they will assess your clinical status, they will assess your blood pressure, glucose, everything, and immediately they will order a neuroimaging. Among the neuroimaging, there are two types of neuroimaging, CT scan and MRI, and most of the time CT scan will be preferred in a case of stroke because it is widely available, easily can be done, and it requires only 5 minutes to get it done. And along with the CT plain scan, we also do the CT angiogram to look at the blood vessel status. Okay, and from the imaging, we categorize the stroke into either ischemic and hemorrhagic stroke. And if it is a ischemic stroke, we again classify it based on the CT imaging findings and the angiographic findings as to whether any large blood vessels got occluded or not. And if there is no large blood vessel occlusion and this is the ischemic stroke, we offer the patient a process of treatment as stroke thrombolysis. Stroke thrombolysis involves giving an injection of alteplase as a bolus followed by an infusion over 1 hour. Okay, and if the angiography is showing any large blood vessel occlusion, we refer the patients to or we proceeded with a stroke thrombectomy, that is mechanical thrombectomy, that is retrieving the clot from these large blood vessels and stent those blood vessels. That is the process involved in the mechanical thrombectomy. So if the patients needs a lot of time to be transferred to a center which is equipped with a mechanical thrombectomy, we can first proceed with the stroke thrombolysis and then can refer for mechanical thrombectomy. And following this acute treatment, other treatments involve the antiplatelets, statins. All these drugs should be continued lifelong. And in patients with any heart conditions like any heart rhythm abnormalities and valvular heart disease, any severe pumping issues in the heart, we may we may start the patient on oral anticoagulants like warfarin, rivaroxaban, apixaban, and dabigatran. And all these drugs should be continued lifelong and should not be stopped unless instructed by the doctor. And along with that, we have to refrain from smoking, alcoholism, and should control our blood pressure and the diabetes. And along with this, also important will be physiotherapy and the speech therapy in case by case basis. And this physiotherapy and speech therapy will help you to reduce this morbidity burden in stroke patients, as the most of the improvement happens in the initial 3 to 6 months. This continuing the physiotherapy and speech therapy at least for 3 to 6 months for the maximum improvement and better care for the stroke patients, as these treatments improves the quality of life of these patients tremendously. Thank you all.